Welcome to the Deep Dive, your shortcut to being truly well-informed. Today, we're diving into something, well, pretty fascinating, a health practice that exists in this really contested space.
hmm
You might actually find it being used in hospitals and nursing settings, yet mainstream science largely rejects it.
It's a stark contrast, isn't it? On one side, you have proponents calling it, holistic, evidence-based, talking about using universal energy for balance and well-being.
Right.
But then the wider scientific community, they often label it as pseudoscience, claims not supported by evidence.
Yeah.
It really highlights this tension, this pull between evidence-based medicine and compassionate care.
Absolutely. And that's our mission today. We want to unpack this practice, therapeutic touch. We'll look at its, frankly, intriguing origins, the theory behind it, how it's done, and crucially, we need to examine the scientific evidence. Or maybe the lack of it.
And also why? Why does it persist in healthcare despite all the skepticism?
Exactly. It seems to be grappling with this fundamental conflict and its identity. Science demanding proof, practitioners may be holding a different view of truth.
Yeah, an irreconcilable conflict almost.
So let's start at the beginning, the genesis. Therapeutic touch, where did it come from? It kicks off with a really unusual partnership back in the early 1970s.
It really does. You've got Dolores Krieger, D. Krieger, a highly credentialed professor of nursing at NYU, PhD, RN, very established.
Okay.
And then you have Dora Kunz. She described herself as a natural healer, a clairvoyant. Quite the pairing, as you said.
Wow. So academia meets the esoteric. What was their goal?
Well, their stated aim was to modernize these ancient healing practices, the laying on of hands tradition.
Right.
They wanted to strip away the religious dogma, reframe it as a professional nursing intervention. The core belief was that healing is just a natural human potential. Everyone has it, potentially.
Okay, so making it secular, making it professional. How did they try to show it worked initially? Was there early evidence?
Well, they did some experiments. Krieger and Kunz, back in '71, they claimed the results showed a significant jump in patients' hemoglobin levels after getting treatments.
Hemoglobin, really?
Yeah. Now, that research was seen as pivotal at the time, got things moving. But it's really important to stress, it absolutely would not pass muster today. Modern methodological standards, no way.
Why not? What were the problems?
Oh, heavily criticized. Major design flaws, tiny sample sizes, no proper control groups. The results just weren't reliable, couldn't really prove anything definitively.
Okay, so flawed early evidence. But then something big happened. Krieger took this, flaws and all, and introduced therapeutic touch into the curriculum at NYU. Is that right?
Yes, exactly. Into the master's program starting in 1972, a course called Frontiers in Nursing.
That sounds significant, putting it right into a major university's nursing program.
It was a masterstroke, strategically speaking. It gave TT this academic legitimacy, something most folk healing just never gets. It kind of bypassed the usual rigorous medical vetting process.
And that was a launchpad.
Absolutely. From that academic base, it just spread. Nurses learned it, took it into hospitals, clinics, globally. Professional groups formed, like the Nurse Healers Professionals Associates International in '79, and later the TTIA.
TTI.
Therapeutic Touch International Association. They help standardize things, promote training, and now
Yeah.
the estimate is maybe 100,000 trained practitioners worldwide.
100,000. That's a lot.
It is, and that unique path, starting with a spiritual healer, getting academic backing from a nurse, then spreading through nursing education. That's really key to why it's still around in healthcare today, despite the controversies.
Okay, that makes sense. So let's dig into the theory now. What's the core idea behind therapeutic touch? You mentioned it's based on vitalistic assumptions.
Right. And these are seen as fundamentally incompatible with the standard biomedical model we generally use in medicine.
How so?
The basic belief is that humans aren't just physical machines. We're open, complex pan-energy systems, constantly exchanging energy with everything around us.
Okay, energy systems. And this energy, it extends beyond the body.
That's the idea. This universal life energy, sometimes called prana or ki in other systems, is thought to form a field around the body. They call it the human energy field, or HEF, or sometimes biofield.
Human energy field and health and illness fit into this. How?
Simple in theory. Health is when that energy field is balanced, harmonious. Illness, pain, discomfort, that's seen as an imbalance. The energy flow is blocked, maybe depleted, or just uneven, asymmetrical.
So the practitioner's job is to fix the balance.
Essentially, yes. A trained practitioner supposedly assesses this field without touching, usually, and then uses their hands to modulate it, or repattern it. The goal is to stimulate the patient's own innate healing ability by restoring that balance.
Hmm. I know they sometimes try to link this to a nursing theory, Martha Rogers' Science of Unitary Human Beings.
They do, yeah. But critics generally find that connection pretty tenuous at best. It's seen as an attempt to borrow some scientific language.
And speaking of language, the term biofield, where did that come from?
That term gained a bit of traction after an NIH conference back in 1992. Proponents of TT and similar therapies often use biofield and other, scientific-sounding terminology.
Right.
Sometimes they even draw these loose connections to quantum physics, trying to give it a scientific veneer. But mainstream physicists reject those interpretations pretty strongly. They see it as misapplying complex concepts.
So we have this idea of a human energy field, but the big elephant in the room is, has anyone actually found it, measured it?
And that's the critical point. No. The human energy field, as described by TT proponents, has never been empirically detected by any verifiable scientific instrument. Its existence simply hasn't been proven. It remains essentially entirely metaphysical.
Which leads to the obvious question, how can you interact with, let alone modulate, something you can't even detect?
Exactly. That's the fundamental challenge for any kind of scientific evaluation.
Okay. So given that theoretical challenge, let's look at the practice itself. How does a therapeutic touch session actually work? What does it look like?
Well, a typical session is described as highly structured and ritualized. It's usually pretty brief, maybe 15 to 30 minutes. And it's non-invasive. The person receiving it stays fully closed.
And the practitioner isn't seen as doing the healing directly.
No, they view themselves more as a conduit. They're channeling this universal energy to help the patient, who they often call the healing partner, activate their own self-healing process.
Interesting. And it follows specific steps.
Yes, very distinct phases, 5 of them, usually done in sequence.
Okay, what's phase 1?
Centering. This is where the practitioner quiets their own mind, focuses their intention. It's about getting into a state of compassion, being fully present. You can see how this step alone, just that focused, calm presence, could be beneficial for the patient.
Sure, creating a calm space. What's next?
Assessing. Here, the practitioner holds their hands maybe 2 to 6 inches away from the patient's body. They scan the area, looking for what they describe as subtle sensory cues, feelings of warmth, coolness, maybe tingling, pressure, stickiness, things they interpret as signs of energetic imbalance.
So they're feeling for problems in this field they're scanning.
That's the claim. Again, that focused attention and gentle presence can be very soothing for someone, especially if they're anxious or in pain.
Okay, phase 3.
That's clearing, sometimes called unruffling. This involves making sweeping downward motions with the hands, still off the body. The idea is to smooth out wrinkles or clear away congestion in the energy field. These rhythmic, gentle movements can often trigger a relaxation response.
Like physically smoothing something out, but with energy. Makes sense visually. Then,
Phase 4 is balancing and rebalancing. This is where the practitioner believes they are consciously directing or modulating the energy. They might focus on specific areas identified during assessment, trying to restore a harmonious flow.
so actively trying to redirect this energy, and the final step.
Evaluation and closure. The practitioner does another quick scan, reassessing the field using what they term professional, informed, and intuitive judgment. Sometimes they might use grounding techniques to help the patient feel settled. Then the session ends.
It's a very defined process.
Extremely. And what's really fascinating here is how the structured nature of it, the ritual, the focused attention, the compassionate intent, the gentle movements, how all of that itself can be therapeutically powerful. It can absolutely induce a profound relaxation response, and you get a significant placebo effect, totally separate from any claims about manipulating energy.
Right. The experience itself is doing something.
Exactly. It taps into well-known psychological and physiological mechanisms.
So bearing that in mind, what are the main things proponents claim therapeutic touch is good for? What are its applications?
Well, first, it's almost always positioned as complementary, meaning it's used alongside conventional medicine, not instead of it. That's an important distinction they make.
Okay. And the benefits.
The most common claims are things like inducing deep relaxation, reducing stress and anxiety, creating a general sense of peace, comfort. Big ones.
Things many people seek help for.
Absolutely. They also claim it helps alleviate pain, both acute and chronic. Sometimes framed as changing the perception of pain. It's often used for managing symptoms related to serious illnesses, think reducing nausea or fatigue from chemo, improving sleep.
Okay. Any more ambitious claims?
Yes, there are. Some proponents claim it can actually accelerate the healing of things like wounds, fractures, even infections. But it's really crucial to state here, those specific claims lack any credible supporting clinical evidence.
Right. Less subjective, more easily measured claims, but no proof.
Correct. And it's also frequently used in end-of-life care for providing comfort, easing the dying process.
When you look at that list, relaxation, reduced anxiety, pain perception, comfort, there's a pattern, isn't there?
There absolutely is. The vast majority of these claimed benefits are subjective, self-reported outcomes,
Meaning?
meaning they rely on what the patient feels and reports, and those kinds of outcomes are notoriously highly susceptible to other factors.
Like the placebo effect.
Exactly. Placebo effects, patient expectations. If you think it will help, it might. The therapeutic environment itself, the rapport with the practitioner, all these things play a huge role in subjective experiences. They are real effects, definitely, but they don't necessarily prove the underlying energy theory is correct.
That's a critical point. So let's pivot to the scientific scrutiny. What does the broader body of clinical evidence say about TT's efficacy?
Well, despite decades of research, the overall conclusion from rigorous scientific reviews is pretty consistent. There is no high-quality, reliable evidence to support the efficacy of TT for any condition beyond a placebo effect.
No high-quality evidence. That sounds definitive. But what about all the individual studies? You mentioned there are quite a few, even recent ones.
It's true. There are numerous small-scale studies. You can find papers from just the last few years, 2021 to 2024, looking at TT for things like menopause symptoms, infantile colic, COPD, labor pain, and many of these individual studies do report positive findings
So why don't they count as high-quality evidence?
because they suffer from significant methodological limitations. Major flaws, really. We're talking very small sample sizes, which makes it hard to generalize. A high risk of bias in how the studies were conducted or analyzed. Often inadequate blinding, meaning patients or researchers knew who was getting real TT versus a sham treatment, which influences results.
Blinding is key for placebo control.
Crucial. Also, using inappropriate or no treatment control groups. You need a good comparison. And again, that heavy reliance on subjective, self-reported outcomes without objective measures. These weaknesses make the positive findings unreliable.
I see. So individual studies might look promising, but they don't hold up under scrutiny.
Exactly. When you take all these flawed studies and put them together in systematic reviews or meta-analyses, which are designed to give a more robust overview by pooling data and critically assessing study quality well, the evidence for TT collapses.
Collapses. How so?
A major review in 2021 looked at lots of studies reporting positive outcomes, but concluded there was no high-quality evidence, precisely because of those pervasive methodological flaws.
Yep.
Even more strikingly, perhaps, was the Cochrane Review. Cochrane reviews are usually the gold standard looking at TT for wound healing. It was withdrawn entirely in 2016. Why? Due to serious concerns over the validity of included studies, they couldn't trust the data.
Wow. Withdrawn completely.
Yeah. And this isn't new. Way back in 1984, a review concluded the empirical support for TT was, at best, weak, and that it was empirically little more than practice of placebo. The story hasn't really changed despite more studies being done.
It sounds like studying these kinds of therapies is just inherently difficult, too, methodologically challenging.
Profoundly difficult. Think about designing a credible placebo control. How do you create a sham TT session that feels identical to the real thing, the attention, the hand movements, but without the supposed biofield manipulation? It's incredibly hard to isolate that specific variable.
Right, how do you fake energy direction?
Exactly. Then there's the issue of practitioner variability in dosing. How much energy is being applied? How skilled is the practitioner? It's all very ambiguous and doesn't fit well with standardized research protocols that demand consistency.
Yeah, you can't measure a dose easily.
And finally, there's always the potential for publication bias. Studies with positive results might just be more likely to get published than those showing no effect, which can skew the overall picture of the available literature. All these factors make getting clear, reliable answers really tough.
Okay, so the scientific evidence is weak to non-existent beyond placebo. This brings us squarely into the great debate. The core criticism is that TT is basically pseudoscience.
That's the main charge, yes. That it's a quintessential pseudoscience built on concepts that are fundamentally unscientific and untestable, like this metaphysical energy field. Dr. Stephen Barrett of Quackwatch has been very blunt, calling the energy theory delusions.
Strong words. And this debate really came to a head with a specific, quite famous experiment, didn't it? The one involving Emily Rosa.
Ah, yes, the Emily Rosa experiment. Quite extraordinary. Published in JAMA, the Journal of the American Medical Association, in 1998. And Emily herself was, what, 11 years old when she co-authored it? Based on her fourth grade science fair project.
An 11-year-old challenging the foundations of this practice. What was her experiment actually testing?
This is key. It wasn't about whether TT made people feel better. That's subjective. It tackled a much more basic prerequisite claim. Can experienced therapeutic touch practitioners actually perceive the human energy field they claim to manipulate?
Ah, the assessment phase. Can they actually do what they say they do?
Precisely. It was a direct test of a falsifiable hypothesis. If they claim to feel the field to assess it, let's test that specific ability. If they can't reliably perceive it, the whole basis of modulating it falls apart.
Makes sense. And how did she test it? The setup sounds pretty simple.
Remarkably simple, but rigorous. They got 21 experienced TT practitioners. Each one put their hands, palms up, through holes in an opaque screen so they couldn't see anything.
Okay, blind.
Completely blinded. Then Emily would randomly hover her hand just a few inches above either the practitioner's right hand or their left hand. The practitioner's only job was to say which of their hands, Emily's hand, and therefore her energy field, was near.
So a 50-50 choice each time, left or right. What did they find?
The results were, frankly, unambiguous. Across 280 trials total, the practitioners were correct only 123 times.
123 out of 280. What percentage is that?
It works out to an accuracy rate of 44%.
44%. But random chance would give you 50%.
Exactly. They actually performed slightly worse than pure chance.
Yeah.
And there was no correlation at all with experienced practitioners who've been doing TT for years, didn't do any better than less experienced ones.
Wow. So they couldn't reliably detect the presence of a hand, let alone subtle energy imbalances just inches away when they couldn't see it.
That's what the data showed. The study's conclusion was pretty stark.
Eh.
It provided unrefuted evidence that the claims of TT are groundless and that further professional use is unjustified.
A damning conclusion published in a major medical journal. How did the therapeutic touch community react to that? Did they try to replicate it, improve their methods?
Well, interestingly, no. Instead of replication or reevaluation, the response from the TT community was largely to attack the validity of the experiment itself.
How so? What were their arguments?
They argued the setup was artificial, foreign to TT. They claimed it lacked the necessary call of compassion or the intention of doing good that's supposedly essential for TT to work. Dolores Krieger herself basically dismissed it, called it a cute idea, but not a valid test of therapeutic touch.
But the test wasn't about healing, it was about basic perception, wasn't it?
Precisely. And what's fascinating is how that line of defense saying it only works under specific, compassionate, intentional circumstances effectively reframes the claims of TT in a way that makes them unfalsifiable.
How do you mean?
If you say it only works when the conditions are right, compassion, intent, etc., and any test that fails didn't have those right conditions, then you've created a situation where your claim can never actually be proven wrong by an experiment. It's a classic hallmark of pseudoscience.
Right. You can always say the conditions were met. They also used an analogy about love, didn't they?
Yes, that came up. Asking things like, can you see love? Do you taste love? Trying to imply that energy fields, like love, are real but beyond empirical testing. But that's really a category error. Love is an emotion, a complex psychological state, not a claimed physical field that supposedly interacts with matter and can be detected by human hands.
It sounds like the whole episode just highlighted this massive gap, this epistemological chasm between how science seeks evidence and how TT proponents understand their practice.
Absolutely. A fundamental disagreement on what constitutes valid knowledge and truth.
Okay, so TT stands on shaky ground scientifically. But as you mentioned, it's not the only therapy claiming to work with energy fields. It's part of a whole family of biofield therapies.
That's right. They all share this core belief in a vital life energy, but they have different histories, theories, and techniques.
Let's compare TT to a couple of the other well-known ones. How about healing touch, or HT? Is that similar?
There are similarities, but key differences. Healing touch was developed later, in the 1980s, by another nurse, Janet Menken. Unlike TT, which is often taught as one main technique, HT is more like a collection of techniques. It's generally described as being more active and directive than TT.
Active and directive, how?
HT uses specific named techniques often associated with the chakra system, things like chakra connection or magnetic clearing. It also has a much more highly structured, multi-level curriculum and a more formalized, rigorous certification process compared to TT.
Okay, so more techniques, more structure in the training. What about Reiki? That's probably the most famous energy healing practice. How does it differ from TT?
Reiki has Japanese origins from Mikao Usui in the early 20th century. The name itself means universal life force energy, Rei for universal, Ki for life force, similar to Ki.
Right.
The biggest difference, conceptually, is the role of the practitioner. In TT, the practitioner is actively assessing and directing the energy. In Reiki, the practitioner sees themselves primarily as a conduit or a channel.
A channel.
Yes. The belief is that the universal energy flows through them and intelligently goes wherever it is most needed in the recipient without conscious direction from the practitioner. They aren't trying to modulate or repattern it themselves. Reiki training also involves specific rituals called attunements, meant to open the student's energy channels.
So TT is active direction, Reiki is passive channeling. Interesting distinction. And one more comparison, Qigong. That's ancient Chinese practice.
Right, Qigong is a pillar of traditional Chinese medicine. It primarily involves specific movements, breathing techniques, and meditation designed to cultivate one's own internal energy, one's qi.
Ah, cultivating your own energy.
Yes. Now, there is a form called external Qigong, which is more comparable to TT or Reiki, where a Qigong master might project their own cultivated qi to help heal someone else. But the emphasis is often on the master's self-cultivation being the source of the healing power, which is different from TT's idea of channeling universal energy or Reiki's passive conduit role.
So these comparisons show there's quite a bit of variety within energy medicine, different ideas about where the energy comes from and the practitioner's role.
Definitely helps see the nuances.
Okay, let's loop back to therapeutic touch specifically and tackle this paradox head on. Despite the lack of scientific evidence, despite the Emily Rosa experiment, it still has this paradoxical and persistent presence in mainstream healthcare settings. Hospitals, long-term care, hospice. Why?
The crucial link, as we touched on earlier, is really the nursing profession.
How so?
Because TT was framed as a nursing intervention right from the start by Dolores Krieger. It got integrated into nursing education, even into formal systems like the Nursing Intervention Classification, or NIC.
So it became an officially recognized nursing thing.
Pretty much. For many nurses, it offered a tangible way to provide what they see as holistic, compassionate care. A way to connect with patients beyond just medications and procedures, addressing maybe emotional or spiritual needs. It gave them a tool for that.
And the institutions themselves sort of legitimized it.
To some extent, yes. When hospitals or clinics create policies around it requiring specific training, needing patient consent, maybe even physician approval in some cases, that integrates it into the normal workflow. It gives it an air of institutional legitimacy, even if the scientific basis is questionable.
That's interesting. And you also mentioned that the justification for using it often shifts in these clinical settings.
Yes, this is really key. You often find that the explicit language about manipulating energy fields gets downplayed or avoided altogether in practice.
So what do they emphasize instead?
They focus on the observable, subjective benefits, justifying its use based on its potential to manage symptoms, reducing anxiety before surgery, helping with pain management, promoting relaxation, improving overall quality of life.
So focusing on the effects, not the proposed mechanism.
Exactly. There are examples of nurses using TT in, say, cardiac surgery units. They use it to help patients relax postoperatively, and they might even report seeing observable changes on heart monitors, slower heart rate, for instance, which indicates relaxation. But that doesn't prove energy fields. It likely proves the power of focused attention and relaxation techniques.
Which raises that important question again. Is it about energy or is it about the human interaction?
And the conclusion many observers reach is that this acceptance isn't really an endorsement of the pseudoscientific theory of a TT. Instead, it's more like an implicit recognition of the therapeutic power of the human interaction that the practice facilitates.
So TT becomes a vehicle.
A structured protocol for delivering compassion, you could say. A ritualized way to provide focused, caring attention.
Okay, so let's try to synthesize all this as we wrap up. Therapeutic touch presents its really profound contradiction.
It really does. It's built on a theory, the human energy field, that is scientifically implausible. Its most basic fundamental claim, the ability to perceive this field, was empirically refuted in a rigorous experiment. And the vast body of clinical research investigating its effects is marred by pervasive methodological flaws.
A pretty bleak picture from a scientific standpoint.
Yet, and this is the crucial yet, Many individuals, patients, do report experiencing significant subjective benefits. They feel better, more relaxed, less anxious, less pain.
So how do we reconcile that? The science says no, but people say yes.
The way to reconcile it, really, is to carefully separate the claimed mechanism, the whole energy field manipulation idea, from the observed effects.
Okay.
The effects, the subjective benefits reported by patients, are often real. They genuinely feel relaxed or less anxious or perceive less pain. But the explanation given by T-theory for why they feel better is almost certainly wrong.
So if it's not energy fields, what is causing those real positive effects?
It's most likely a combination of well-understood psychological and physiological mechanisms. Powerful ones, too.
Such as?
The placebo effect, number one. Mobilized powerfully by the ritual, the practitioner's focused intention, the patient's expectation. Number two, the induction of the relaxation response, that physiological state of deep rest that counteracts stress. TT's process seems tailor-made to induce this.
Right, the calming effect of the ritual itself.
And number three, maybe the most important and often overlooked, the simple, profound therapeutic value of receiving, say, 20 minutes of uninterrupted, focused, compassionate attention from another human being, especially in a healthcare system that can often feel rushed and impersonal.
The human connection element.
Absolutely. So the structured process of therapeutic touch acts as this potent vehicle for delivering these non-specific yet powerful therapeutic elements. The ritual carries the compassion, the attention, the expectation.
So thinking about the future, where does this leave therapeutic touch?
Well, its future, and maybe the future of many similar practices, really seems to hinge on a willingness to embrace intellectual honesty.
What do you mean by that?
If proponents continue to insist on the energy-based mechanism, the one that lacks evidence and has been refuted, then TT will and should remain classified as pseudoscience from a scientific perspective.
But is there another path?
Potentially. If the practice could be reframed, studied, and presented honestly as what the evidence suggests it is, a structured, non-pharmacological technique for inducing the relaxation response and leveraging the power of therapeutic presence, then it might find a more honest and sustainable role within integrative care. Focus on what it actually seems to do, not the mystical explanation.
That's a significant shift in perspective.
It is. This whole deep dive really is a call for more clarity and rigor in how we investigate healing practices, how we describe them, how we implement them. We absolutely need to learn to distinguish what might be biologically plausible from what is psychologically powerful. They aren't always the same thing.
A really important distinction. So the final thought for you, our listener, reflecting on this case study of therapeutic touch, with its scientific implausibility yet perceived benefits and persistence, what does it tell us about how we evaluate healing practices in general? How do we balance evidence, experience, and compassion? Something to definitely mull over.